With cases of Omicron rising throughout the United States, Americans are scrambling to distinguish the symptoms of this new variant from those of other coronavirus variants, including Delta. Most PCR and rapid antigen tests can detect Omicron. The Food and Drug Administration has noted there are only a few tests that don't, but results do not indicate to the user which variant they are infected with, leaving people to guess. Some symptom differences have emerged from preliminary data, but experts are not certain they are meaningful. Data released last week from South Africa's largest private health insurer, for instance, suggests that South Africans with Omicron often develop a scratchy or sore throat along with nasal congestion, a dry cough and muscle pain, especially low back pain. But these are all symptoms of Delta and of the original coronavirus, too, said Ashley Z. Ritter, a nurse practitioner at the University of Pennsylvania. Given that Omicron has only been circulating for only about 3 weeks, she added, it's still too early to say that there's any difference in symptoms between the Omicron variant and previous versions. It's likely that the symptoms of Omicron will resemble Delta's more than they differ. There's probably a huge amount of overlap between Omicron and the prior variants, because they are essentially doing the same thing, said Dr. Otto O, an infectious disease physician at the University of C. If there are differences, they're probably fairly subtle. One possible difference is that Omicron may be less likely than earlier variants to cause a loss of taste and smell. Research suggests that 48% of patients with the original SARS-CoV-2 strain reported loss of smell and 41% reported loss of taste, but an analysis of a small Omicron outbreak among vaccinated people in the Netherlands found that only 23% of patients reported loss of taste, and on. It's unclear, though, whether these differences are because of Omicron or some other factor, like vaccination status. Indeed, many COVID-19 symptoms vary depending on a person's vaccine status. Maya and Clark-Cutaia, an assistant professor at the New York University Meyers College of Nursing who has been following up with COVID-19 patients throughout the pandemic, said that vaccinated patients with Delta or the original coronavirus tend to present with headache, congestion, sinus pressure,